All right, welcome back. Well, back pain is a common complaint for a lot of us. And if it is for you or a friend or a family member, you're in luck because Dr. Daniel Taylor, head physician from Pivotal Pain Solutions, is here with some advice. Hi, Dr. Taylor.
Hi.
Good to see you. What can cause, I'm just going to jump right in, what can cause lower back pain?
Sure. Well, lower back pain and even neck pain can come from many different things. Oftentimes there's some kind of injury that might be a sprain or strain, but most of the time a disc herniation is involved. And I actually brought something today to illustrate that.
Okay, please do.
So we've got the bones here in the spine. The disc is the squishy space between that, like a pillow that leaves room for the nerves to come out, to communicate. It allows the brain to communicate out to the body, the organs and muscles, what to do. Now, when we have a herniation, that disc kind of bulges out like that. A lot of people commonly know this, as a disc bulge, and that presses on that nerve, causing severe pain for many people.
Sure.
But also dysfunction in the musculature, nerves, and even the blood vessels.
Right. Okay. What is then the standard approach to treating back pain? And in your opinion, does that treatment work effectively?
Sure. So you've got the conventional methods like pharmaceuticals, maybe pills or injections, and physical therapy too, and even surgery. And then there are also alternative methods like maybe acupuncture, chiropractic, or massage. And all of those things work for some people, but for someone like myself who had a traumatic back injury years ago, I tried most of those things and really got no results.
Sure.
As a doctor, I'd seen some of the horrific issues with back surgeries, and so I really wanted to avoid that. The other things really didn't work for me, whether it be conventional or alternative, and so I really sought out these alternative solutions that can really make a big difference. They worked for me, and at this point have worked for hundreds of my patients.
Excellent. And if you have had lower back pain, you just want it gone, right? And when you keep trying and keep trying, there's a little bit of hope in what you say. So what is your then recommendation to treat back and neck pain without surgery, without drugs?
Yeah, well, it's really important to avoid those drugs and surgery if possible. And of course, there's a place for that and a time for that. But let's try some less invasive measures in that time. You know, there's a reason why it's important to avoid those things if possible, because really they're there to address the symptom, the pain. And you always think pain is our body's check engine light telling us that there's something wrong.
Sure.
There's something there that needs to get fixed. And if your car, if the check engine light came on, would you take it to the shop and just say, turn that light off for me?
My husband would tell me to take it, yeah.
Right.
I know you should, doctor.
Right.
I know you should.
But you wouldn't want the light turned off.
Of course
you would actually want the problem to get fixed.
Right.
And so that's what our methods do. They actually fix the problem, and then the pain goes away. So we want to actually fix the body's engine and not just turn off the check engine light of pain.
Well, then let's speak about your methods. What do y'all do?
Yeah, so in our methods, we don't treat the body like a car with brakes that need to be fixed. We treat the entire system. So our methods will address the structural system, the bones, also the joint to decrease inflammation there, improving blood flow, and also make sure that those nerves heal. Because even with things like surgery, when the bones are put back into place, there's still leftover damage to those nerves. Nerves take a long time to heal, so it's important to use methods that will increase that healing process.
All right, doctor. Whom is a specific candidate then for your treatments?
Sure. So anyone that's dealing with pain, whether you've tried the conventional and alternative methods or not, we've got something new that addresses each part of that process to make sure that your body receives the healing. So whether you're somebody that's had that severe injury or this popped up out of nowhere, we've got options to help.
I love it when people come on and they have a special offer for our Atlanta & Company viewers, so tell us what that is.
Sure. So we've got an offer for just $29. You'll get a consultation, exam, and x-rays along with that.
Well, doctor, it was a pleasure to meet you. Thank you so much for all this great information, this great knowledge today. We appreciate it.
Yeah, thank you.
All right, don't forget to call 943-202-4760 for more information. And thank you to Pivotal Pain Solutions for sponsoring that segment. All right.